I am Bob Maurer, and I will serve as tonight's moderator. Tonight's forum is an opportunity for residents to gain accurate updates on the pandemic in Revere and for residents to ask questions of the two individuals who are most instrumental in shaping Revere's response. We have received a number of questions in advance, but for those who are watching live and wish to ask a question, please type it into the chat section of the Facebook page. We will begin tonight's session with a few opening remarks, first from Dr. Nathalee Kong. Dr. Kong.
Okay. Good evening, everyone. I guess to start off, I will share my slides as per usual. Ready. All right. So to start off, sorry about that, technical difficulties. Here we go. Gosh, where are you? I'm sorry. Okay. Well, I hope everyone can see that. So as always, here's just the Massachusetts daily case count over the last 30 days. As you can see, we are, all the way over to this tail end, staying pretty stable. In the summer, we nadir'd at around 200 cases on a 7-day average, and now we're up to 300, high 300s to low 400s. And this is the Revere numbers, which usually mirror Massachusetts numbers very well. What we saw over the last 4 weeks in the month of August was a bit of an uptick in cases. Our average case count went from single-digit cases numbers a day to about 12 to 14 cases on average per day. And I just want to also make clear that though we have a couple of testing sites in the city of Revere that test all comers and folks from many different cities, all the data that I'm sharing today and that I have been sharing in the past and will continue to share in the future represents data from just our city and just our residents only. This is the positive per capita cases over the last 2 weeks. As I think everyone is aware of now, Revere is one of 4 cities that are kind of hotspots for the virus right now. We're up there with Chelsea, Lynn, and Everett, the top 4 per capita cases, with the average of Massachusetts all the way over, for the whole state of Massachusetts, all the way over on the right in the green bar. I think this graph here shows a little bit better the uptick of cases we've been experiencing in August. As you can see, we're slowly kind of going up back to close to levels we were at in May, certainly continuing to rise compared to June and July. I think August was just a really tough month for us all in general. I recognize that the fatigue from the coronavirus is real. It's really heavy. I think a lot of us were hoping that it would, be gone by now and that we'd have a normal summer. And I think it's that kind of fatigue is allowing us all to let our guard down and have our vigilance be not as high as it used to be. I think, unfortunately, because of the uptick in cases, we had to make a number of tough decisions this past month, which, spanned the gamut from canceling in-person graduation for our graduating seniors to starting the school year on a remote learning only model to even shutting down some of our parks because of non-compliance with mask and with mask wearing policies and social distancing. However, we also expanded the testing for our residents and for other folks in the area. The Stop the Spread campaign stayed open for another month and will remain open until September 30th to test all of our residents and among other folks in neighboring cities that are experiencing an uptick. And thanks to that, we're able to kind of gather this data and continue to work with our contact tracers. That work is continuing to prove critical as we understand better who is getting the virus and why they're getting the virus. So I put up this relatively new graph because I think it's one way that we can show you how the virus, who is getting the virus nowadays, how that's changing. You can see in June and July, the numbers of patients between the ages of 20 to 39 who are getting the virus is really going up. And that is compared to folks in the older age range, so 60 and above. We're really outpacing the numbers of cases there. So even though you may think that you're very healthy and you don't have any pre-existing conditions, please remain vigilant. Younger folks are getting the virus. They may not be getting as sick, but they are still getting the virus, and they're able to spread the virus to family members, to friends, and to our entire community. The other thing that I'll note is that a lot of our cases are also coming from large gatherings. All right, I know it can be hard to think that that your large gathering can't spark the type of spread that we're seeing in our city, but I just want to take a minute to remind everyone and kind of turn back the clock to February of this past year, when a biotech conference in Boston, indoors at the Marriott Hotel in Boston, had about 175 folks in attendance. Obviously, they weren't wearing masks, they weren't social distancing, we didn't know much about COVID then, but they came from all across the globe. And studies now show that we could link that conference to about 20,000 COVID-19 cases in the Boston area. So that one indoor gathering of 175 led to a huge wildfire spread of this virus in Boston. In addition, something a little closer to home and a little more recently is a wedding in Maine. On the first weekend in Maine, they were inside a packed church, not socially distant, not wearing masks for the ceremony. And then after the ceremony, the reception was indoors in a restaurant. And that led to, there was about 62 folks in attendance in that wedding. And that led to an additional 123 cases to date. This was last updated, obviously, on August 29. So we don't know how many more cases could have come from that wedding. But suffice it to say, please remain vigilant and please continue to wear masks, continue to social distance. If you are going to gather with folks, try your very best to gather outside. Those two examples I just shared with you, they were both indoor events. So if you can, try to gather outside if at all possible. The governor earlier in the month of August put out new guidelines for gatherings, and the cap for outdoor gatherings is 25 individuals, or about 25% of the capacity for that establishment. So if it's like an outdoor bar or an outdoor restaurant. So please keep that in mind, because in the past it used to only apply to professional or commercial establishments, but that also applies to private events as well now. Right? That was a change that happened around August 7th of this month. So in addition to, practicing social distance, wearing a mask, something else that is important to do is to continue to get tested, all right? And especially if you don't feel good. Right now, the criteria for getting tested for coronavirus is if you have symptoms, so fevers, difficulty breathing, runny nose or stuffy nose, muscle aches, or a loss of taste or smell. That is one criteria to get tested. But another one is if you have been in close contact with someone who tested positive for the virus. So as I had alluded to before, we have many different places to get tested, but two prominent ones in the city of Revere are part of the Stop the Spread initiative. You can walk up or drive through. There's one site in the Revere High School parking lot and another one at the Marquee Footbridge by the beach. You don't need insurance. No one's going to ask you about your immigration status, and results are pretty quick. You get them around 3 to 4 days. The hours are here. This is right at the revere.org/coronavirus website. So I hope everyone will take advantage of this testing while we have it. We're hoping to expand it obviously beyond September, to be determined for that. The last thing I wanted to put a plug in for is the flu shot. So we're heading into the flu season this fall and winter, and I can't stress enough how important it is for everyone to get vaccinated. If you can, either call your PCP's office or go to your local CVS or Walgreens. Getting the flu vaccine not only protects you from getting the flu, but it protects you from potentially getting sick enough to have to go to the hospital this winter. And if there is a surge in coronavirus, you definitely don't want to be in the hospital. Another reason to get the flu shot is to also minimize our hospital capacity, or rather to free up our hospital capacity to care for those who have coronavirus, who are really sick from coronavirus, so that you protect yourself and you just are one less person taking up a hospital bed, or God forbid the ventilator, and we're able to kind of conserve those resources for those who are really ill with coronavirus. Let me stop sharing my screen. So that's all I have now. I'll turn it over to you, Mayor.
Thank you, Dr. Kong, and thank you for the great work that you've done on behalf of the residents. Right now we're entering our 6th week where we're seeing the data trend away from where we want it to be. And I appreciate the presentation that you gave, Dr. Kong, and some of the information. And what we want people to understand is that we're consistently seeing numbers that are much higher than the state average, and that is preventing us from moving forward and reopening. But we aren't alone in this. As Dr. Kong mentioned, we're working closely with some of our neighbors, Lynn, Chelsea, Everett, East Boston, Winthrop is also part of this, on some regional strategies to bring our collective numbers down. And so we've been working really closely with the governor and other partners at the state level to make sure that we're getting additional resources, additional support. You've probably seen some of that. We have had the ABCC, which actually controls the alcohol and beverage commission that oversees some of the bars and restaurants that have liquor licenses. They've been out doing oversight checks in establishments in our city. For the most part, we've seen some compliance, which is great. But those kind of checks will continue. You also have, I'm sure, seen the reduction in parking along the beach, and that is in advance of Labor Day weekend. We do expect some nice weather. We do want to get the point across again that this hasn't gone away, and that we have to take some measures to prevent people from gathering. So while we've taken some measures, we've also been making sure that we're ramping up enforcement and the efforts that we have around enforcement, and ramping up education. So we announced last week, I believe, that we were going to be hiring ambassadors. And the idea behind this is that we wanted people who will help us get into neighborhoods across the city and have direct conversations with their neighbors, help us distribute masks, and also connect them with other resources such as food and resources around employment opportunities and resources around rental assistance that we have. We're also beginning to step up our enforcement of the governor's revised orders that Dr. Kong alluded to. We know that we're going to continue and have to continue to be to be flexible and kind of do things as take action as things arise. So Dr. Kong mentioned having to shut down some playgrounds and parks. Unfortunately, we have had to do that, and we're going to continue to do that if we find that people are gathering on those sites in large groups without masks. We had to close the basketball courts at the Harry Delarusso Stadium because people weren't complying with safety regulations that we have in place. And so all of that is really frustrating. It's the last thing that I want to do. The last thing that I want to do is have to, change graduation from an in-person ceremony to a drive-by ceremony. The last thing I want to do is shut down basketball courts or playgrounds. And so it's incredibly frustrating for me, for us as a community, to be where we are today. And I know that so many other people are frustrated with me, and I feel that, and I understand that. And I know that you're tired, and I know you're sick of hearing me probably talk about COVID, probably as much as I am sick of saying COVID. But the reality is that we're in this situation, we're in it together. And so the actions that we're taking now are to avoid us from being back where we were in April and May. Those graphs that Dr. Kong put up earlier, you saw the numbers in April and May and how high they were. And we want to avoid that, number one. And number two, we want to resume a normal life when we can and as quickly as we can. So what we're asking of all of you is really similar to what we've been asking all along. And I know this may sound like I talk about how some of the messaging that I have may sound like Charlie Brown, the teacher voice in Charlie Brown, but we've been asking the same things for you to do continuously. Wear a mask, limit your exposure to other people, practice social distancing, don't get together in large groups. And I know that everyone's sick of hearing it. I'm sick of saying it, but it's what we have to do. It's what we know we have to do to keep the virus in check and to protect each other. So I'll end with that and say that piece of it, talking about education and enforcement. And I do want to shift gears to something that I know a lot of families and a lot of young people are interested in or want to hear about, which is schools. And I want to touch briefly on this topic because I know that people are antsy and interested in knowing what exactly is happening. So the school year will start for students on Wednesday, September 16th. Schedules are being finalized and they will be sent to parents by Tuesday. Teacher assignments are also being finalized and they will be provided by Monday, November 14th. On last Friday, the school committee and the city reached an agreement with the Revere Teachers Association to start school on time and to do everything that we can to best serve our students. There are some other items that have to continue to be negotiated with the teachers, and that is ongoing. But what we are in agreement with is how to begin the year and start the year and what that will look like. So for right now, the beginning of school, all students will be learning remotely until some of the data that Dr. Kong provided and some of the data that the state provides shows that it's safe for us to enter into a hybrid model, which would allow some students to come in, or students to come in some of the time into the buildings. Yesterday, teachers started their preparation for the school year, and a first day for students in just a couple of weeks. The school department is going above and beyond, and I have to give so much credit to Dr. Kelly and her team and every single person that works in the school district for what they've done. And I want to just recognize their work they've been working for months to get us ready for a number of different situations and scenarios, and really trying to come up with a way to overcome every challenge and think through every challenge, and making sure at the end of the day that students and teachers have access to technology that they need, making sure that our buildings are safe, making sure that we have enough PPE for everyone, and thinking about all the different needs of our students and how we can serve them and how best to serve them. And one thing that's important to note is that this also includes training dates for parents. This is something that I've heard a lot of, and I hope this is something that a lot of parents take advantage of. But it's for parents to learn more about the technology that the school department is using, and the times that they can, with social distance and mask wearing, meet with their children's teachers. I know that's an important part of the education process, and that's something that we will be providing. I know that this is not an easy time for anyone in our city. It's certainly not easy for our parents and the families of the children in our district. And I know that there's a level of anxiety that comes along with so much uncertainty. But I do want everyone to know that our families will be hearing from school principals about final plans for their school this week, either by the end of this week or early next week. You will be hearing from the principal. So with that, again, I want to thank Dr. Kong for her incredible work for the residents of the city. And I'm sure we have plenty of questions that we can jump right into. And with that, I turn it over to the question portion of our town hall.
Okay, thank you, Mr. Mayor. Most of the questions do relate to the schools, and you have addressed most of the in your discourse. You mentioned most of the answers. There is a question that seems to be some confusion about exactly what the starting date is.
Yep. So the starting date, as I alluded to earlier, the starting date for students will be September 16th, Wednesday, September 16th. The teachers are in right now. As I said, they're in the classrooms. They are preparing for the beginning of the school year. As you can imagine, it will take a little bit of work for them to get up and ready and be prepared for remote learning. But the beginning of the school year will be the school year will begin September 16th. And as I said, teacher assignments will be finalized and provided by Monday, September 14th. And schedules are being finalized for the students, and those will be available to parents on Tuesday.
Getting off the topics of schools, this is a question for Dr. Kong. It's somewhat rooted in information that came out of the Center for Disease Control over the past couple of weeks, and that is how deaths related to COVID are determined. And there was quite a bit of controversy. I think the CDC was trying to clarify the issue, but may have caused more confusion, and that seems to be the tenor of these particular questions. How exactly is a COVID death determined compared to a death caused by other organic circumstances?
So I don't know. I'm going to take a stab at answering this. I'm not 100% sure my answer will be accurate, but the way deaths are determined for any cause is obviously easiest in the hospital. Deaths can happen outside the hospital, say in a nursing home or even at home. When you have a death in the hospital, there is a death, actually for any death, there is a death certificate. So the physician fills out the death certificate and says what the reason of, or the cause of death was, whether it was a cancer or a heart attack related to coronary artery disease, or if it was respiratory failure related to COVID-19. So the main thing in determining what are deaths caused by COVID-19 is, well, did the patient have COVID-19? Yes or no. So that's kind of one big junction point. The next one would be, was the immediate cause of death related to that? If someone had like a seizure or something, or if someone got into a car accident and they just happened to have tested positive for COVID a few days ago, it's hard to make a link with that. It may come up in their chart, and it could come up in the death certificate, but it's hard to make a link for that. So there is some kind of language in filling out that paperwork where it kind of says, like, you should be linking this death to like a certain cause. As you can see, it is, obviously, I don't want to say prone to error, but it is just, other humans filling this out, other doctors filling this out and making their best guess. Oftentimes it is pretty, especially if the death occurred in the hospital, it is pretty clear what the cause of the death was. Situations where it may not be so clear is if the patient died at home, like died in their sleep, and you just aren't really sure. I hope that answered the question. There's a lot of, it is a little tricky.
Okay, thank you. Thank you, Dr. Kong. This gets back to some administrative issues in the city. Mr. Mayor, will the city continue to waive fees for paying taxes and water bills online?
So that is something that we did implement during this crisis, and something that we would look to continue to provide to residents. We certainly want to make it as easy and accessible for people to be able to pay their bills and be able to do it online if they so choose, without getting an additional fee for that. So that is something that we would consider extending. I know that there is a cost that comes that's associated with that, and that's something that we will take a look at. But I think as long as we can continue to provide that, and as long as we continue to see the numbers show that we should probably try to keep people out of buildings like City Hall, that we will continue to allow for those payments to be processed without additional fees.
Dr. Kong, a question that's in your department, and that is when people are using masks, is that, and this has been a repeating theme throughout these, when people are using masks, is that helpful to themselves and to other people?
Yeah. So first and foremost, using a mask benefits mostly other people. When you use a mask, you are preventing your personal respiratory secretions from getting out into the air and getting out onto somebody who may be very close to you or just less than 6 feet away from you. You're also preventing your respiratory secretions from landing on nearby surfaces like a kitchen countertop or a dining table. And by preventing that from happening, you prevent someone from coming by, putting their hand on that high touch surface, and getting the virus that way. You're also preventing yourself from touching your own nose and mouth, because again, the way the virus enters our body is through mucosa that exists in our nose, mouth, and our eyes. There is actually some increasing evidence that wearing a mask may also benefit the wearer. So if no one else around you is wearing a mask and you were wearing one, there is some evidence trickling in that it could also benefit you, and that it might help you from getting their secretions and from getting COVID. I haven't parsed through that data out as much, so we'll see as more data comes in, if that's borne out or not, and if that's true or not. But what I can say unequivocally is that you are protecting your community by wearing a mask. Wearing is caring, and you should definitely do that as much as you can so that you can protect other folks around you. And if we all do it, we're all going to protect each other.
Thank you, Dr. Kong. Mayor Arrigo, this has to do with basically what the city is doing in terms of enforcement with commercial establishments. Specific question dealing with limits in some of the larger stores, but on a more general sense, what steps the city is taking to enforce the governor's orders regarding gathering and opening of public facilities or commercial facilities.
Yep. So we've done a few things. We have our inspectional services department continuing to monitor situations at big box stores and other retail spaces. We do receive complaints when there are businesses that are not adhering to some of the regulations, and we have been down and we have made sure to follow up on those issues. And we've seen, I have one good example of Stop and Shop. I know Stop and Shop over on Furlong Drive was one that we had received a few complaints about in terms of mask wearing, and we went down there. Michael Wells does some great work for the city. Michael kind of went down, spoke to the manager down there and some other folks, and just reminded them. And we've seen additional compliance, and I've heard that myself from people who have said, "Hey, this is something that you should look at," and then they follow up and say, I'm starting to see some better compliance with mask wearing. So I would implore any resident, if they are seeing anything, to please let us know. One other thing that's important, and I touched on the ambassador program, and what we're doing is we're using federal money to be able to bring those people on board for the city. We're also bringing on additional inspectors, and more than being just an inspector, we want them to be somebody that is able to provide information and basically provide the ability for businesses to be able to overcome any barriers or challenges that they may have to being able to wear masks, and or provide information to them about that. So I always try to make sure that we're providing enough information and that we're consistent with that. And so whatever we can do and however we can leverage federal money that the city's gotten through this pandemic, we're going to, and these are the next steps that we're taking. The last thing I'll say is that we have considered, and Dr. Kong knows this, we have considered, potentially rolling back some of the capacity limits that we have for certain stores, certain retail outlets and things like that. And I would say that, and I know that we've done the work to make sure that if there is an issue, or if we see data that is provided that shows that there's an issue with a specific location or a certain business or a certain place, that we're going to take action on that. But one thing that we haven't really seen is that that there are cases coming out of a certain business or a certain location, and so when we see that, when the data kind of supports that, we'll take action, and potentially rolling back capacity limits is something we've talked about, but not something that we've done just yet. And this is an ongoing, and it will be an ongoing situation, and one where we have to be really flexible, and we have to adapt. And that's what the city is doing, and that's what we're, through having ambassadors or having additional inspectors, and having everyone communicate with each other and communicate with the businesses and with the residents. We're confident that we'll start to see the numbers trend in the right direction.
Thank you, Mr. Mayor. Staring back towards the schools, a question is arisen of where some of the school buildings are older, and the concerns about HVAC systems within those schools. What is the city doing to prepare the older schools where the HVAC may not be up to the standards that it is in some of the newer schools.
Yep, and as you can imagine, this was a point of a lot of conversation with the Revere Teachers Association, and we do have 3 facilities that we need to work on, and I will say that Dr. Kelly's team, including Carl Svensson, who is the director of facilities, have done an amazing job in terms of getting on top of the work that needs to be done, making sure it's happening, and being or attempting to be creative about what can be done. And so the first thing is to assess what condition the buildings are in. Luckily, we do have a lot of newer school buildings, and so we're not in a situation like some other communities where they have a large number of buildings that are maybe not in as good a condition, or the HVAC isn't as good as a newer building. So we are in a pretty strong position because of the newer buildings we have. With the buildings that we know may need some upgrades, there may be some smaller improvements, such as cleaning HVAC systems and upgrading them a little bit to be able to comply with the regulations that we need to comply with. And in some cases, we may even have to install windows or additional ventilation units. And so those are all things that are being done actively, like right now, and have been worked on for a while. So I would say that with the staff that Dr. Kelly has in place and the leadership of Dr. Kelly, we know we're not going to ask people to be back in buildings that are not up to a safety standard, and we will make sure of that, and we've committed to that, and that's been something that we've talked about time and time again. The one thing I will note is that Dr. Fauci recently said that it could be as simple as opening a window in terms of the ventilation process and the things that need to be done, and that may seem like a very or not a very innovative way, or very basic way of providing ventilation, but that is something that has been kind of stated and kind of widely agreed upon, is that ventilation of a room or a building will be improved with an open window. Now, of course, there are challenges that come along with that, and winter being one big one. So it may be nice to open a window right now, but if we get into December, January, February, that may not be something that we can rely upon. So this is something, again, as I kind of have said already. We need to be flexible. We need to be able to adapt, and these are things that we're adapting to. And we have the team. I'm really I feel grateful for the fact that we have such a great team in place to be able to make sure that schools can be held, and the district can teach the children in the city in a safe way, and we will make sure that happens.
If I could also just add one thing, Mr. Mayor, the studies that have been published as well regarding airflow and what the recommended amount of airflow or air passes in a standard size room was also based on a room capacity of 30 individuals, which I don't know if that's something we'll be doing in our classrooms anytime soon anyway, even if a hybrid model comes to pass. If you have one person or 7 people in that room, then the amount of air pass and airflow is not going to, that amount of airflow required won't be as high as that, as those recommended kind of on the web, on the internet and stuff right now, because most of those studies were done for rooms full of 30 people. So it's something else to keep in mind of too when we're thinking about what is appropriate and what will be adequate versus what could be overkill potentially, which is not a bad thing, but just something to think about.
thank you for that point. That's a great point.
Dr. Kong, earlier in the evening, you referred to the uptick in cases in various age brackets. And this question pertains to demographic or common themes. So it is essentially what demographic or common theme are you seeing in the infection rate, and how does that affect the city's response, either from a enforcement point of view or a medical treatment point of view?
Yeah, I mean, as I mentioned, we're constantly working with our contact tracing team, because that is how we can find individuals who have tested positive, and that is how we're able to help them to quarantine and support them, and thus prevent a rapid spread of the virus like we saw back in the springtime. It's better to quarantine 1 or 2 individuals than to have to essentially shut down an entire city or state, and shut down businesses and shut down schools. And thankfully, with more River residents getting tested, and more of us, kind of finding out, if we're asymptomatic, pre-symptomatic, or just confirming that we have COVID, we've been able to gather a lot more data about who's getting the virus and how are they getting the virus, or why. As I mentioned before, the data shows that younger individuals are now getting the virus. So folks in the 20s, 30s, 40s age bracket, versus back in the spring when it was a lot of older folks with pre-existing conditions. The difference in how the disease manifests in younger folks is that it's not as severe. They're not as likely to end up in the hospital or be on the ventilator, which is why we haven't seen any huge uptick in our hospital capacity levels. Our hospitals are actually still pretty good and still wide open for cases, which is great. That's how we want to keep it. But the downside, though, is that because younger individuals aren't going to get as sick, they actually might be more able to spread it. Because if you're sick in the hospital, you're essentially self-quarantining inside a hospital bed. But if you don't know you have the virus, if you don't get tested, then you risk spreading it to other folks. Another thing we've learned from contact tracing is that a lot of our new cases are coming from large gatherings, all right? When folks may not be as vigilant or strict about mask wearing, when they may not be necessarily 6 feet away. And these large gatherings could be indoors or outdoors. Regardless, it seems like most of them are coming from these gatherings. They're not coming from someone who went to the grocery store or who went to the pharmacy to pick up their medicine. They're not even coming from folks who went in to see the clinic to see their doctor. They're coming from these large gatherings, which is why we've been really trying to get that singular message out, to try your best to avoid large gatherings. Don't host or attend if possible. And if you are, please try to make it outside at all costs, where the ventilation and air circulation will most definitely be better than indoors. And wear a mask and remain 6 feet away and wash your hands at all costs. I know it's different. This is definitely shaping up to be a much different summer compared to previous. But it's what we have to do to keep each other safe, to keep our economy open, to keep our kids in school. I'll add one more thing, is that to that point, the mayor has made those tough decisions to ramp up enforcement, to get those ambassadors and get more eyes on the ground, or eyes in the sky, boots on the ground, and to unfortunately close down parks where people may not have been as strict about it, and they have been more lax about their mask wearing and social distancing. So we'll unfortunately have to continue to make those tough choices, but I think nevertheless, those are the choices that will result in a reduction in our caseload, and ultimately safety for all of our residents.
Thank you, Dr. Kong. Mr. Mayor, I'm going to repeat a question because the sense that I'm getting from the comments is that people just aren't understanding what you have already explained in that regards, the efforts being taken in the schools with with respect to HVAC systems, particularly in the older schools. One question had to do with windows that don't open. And I know that you already went over this, but for some reason, several people either didn't hear it or didn't understand it. So it's worth repeating.
Yeah, and in the case of windows that may not open, or even windows that may not be in a classroom, we've literally taken the step of building windows inside of windows to try to make sure that there is some air circulation in a classroom. And I mentioned Carl earlier. Him and his team, and Dr. Kelly and her team, have been coming up with all different options. Like I said, it may be some things as easy as some maintenance or cleaning of an HVAC system. And in some cases, it may be as extreme as building a window inside of a window, or making sure that there's airflow in a classroom. And again, these are things that we are doing to adapt to, as Dr. Kong said, standards that are out there in terms of airflow. And we're putting really every option on the table and saying, how can we get through this? And we've been doing this. It's not like this happens overnight. We had an air quality testing done of all of the school buildings. Take samples of each building, so we know where there may be some issues, and then we dive into those issues. And so this is all work, as I said, that's being done. And it is continuous, but it goes, like I said, so far as even, and Dr. Kelly shared a great picture pretty recently of a window being constructed inside of a window that may not have provided as much airflow as it could. So again, we're putting every option on the table, and we're willing to do everything that we can to make sure that the buildings are safe.
Thank you, Mr. Mayor. Hopefully that clarified some of the questions that have come up. This other question has to do with large gatherings in the city, and that is whether the city's enforcement personnel have encountered any prevalence of large gatherings in the city, and what the city is doing to combat those.
Yeah, so we recently announced the fact that we would be having enforcement teams that would go out, and so a combination of city staff have been out and enforcing and reviewing when there is a large gathering and whether or not they need to be fined. And so the city has the ability to through state law to serve a civil fine. And so we would be looking to leverage the ability that the city has based on state law to leverage those. And I think the point isn't to fine people. The point isn't to try to get revenue from this. This is not a revenue generating idea or something that we want to do. It's something that we want to make sure people understand that what they're doing is putting people's lives at risk. And if that's not clear now, I look to the folks who are watching and listening to be advocates and ambassadors themselves in terms of making sure that that's clear, that when you do things like not wearing a mask or like gathering in large groups, you are putting lives at risk. We just had 2 people pass away last month. We hadn't had a COVID-related death in a few months. We had 2 people pass away in August. I know that there are people who work for the city, and I saw one today who I was very grateful and happy to see up on his feet. That person was in a coma. That person was intubated. That person was their life is different than it was in February of this year because of this virus. So this is very real. It's personal to me, and to think that that people continue to do things such as gather in really large groups. It really is frustrating. So we're not looking to hand out big fines to people, but we need to get the message across that this cannot happen. And the way we do that is by leveraging every option and tool that we have available. And one of the tools that we have available is a civil fine process. And so that is something that we are going to actively be doing, and something that that we want people to report. So again, I ask people to make sure that they're being vigilant, that they're also willing to let us know if you see a neighbor having a big event without any masks. We want to know about it. You can call the police department. You don't have to call 911. You can call 781-284-1212, and you can report that is happening, and we will take the appropriate action to make sure that that homeowner knows that they shouldn't be doing. They're doing something that they shouldn't be doing. And I really want to lean on anyone that's watching and any residents to let us know, because again, I can't. It doesn't get any more simple than the fact that if you are not doing the things that we're asking you to do, you are putting lives at risk, and it's as simple as that.
Mayor, would you just give a quick direction to viewers who are wondering where do they find out about information other than forums such as this? I know there's the city website, there's the state website. Do you want to just comment on that?
Sure. We have plenty of information available on the city website. We have a whole page dedicated to information related to COVID-19. Obviously, there's information on the state website as well. And this is something that we've sent flyers out to residents. We are looking to kind of refresh some of our communications in terms of getting out to the residents, and that's why we have an ambassador program. And we're looking to make sure that there are conversations being had, that people are getting information in really kind of any different way possible. So that may be social media. It may be a flyer that they get at their door. It may be in a conversation that they have with a neighbor. But we know that we need to do a better job of getting that information out.
Dr. Kong, there seems to be some comments that people question the necessity of enforcing against large groups when you have family all gathered together. Would you address that from a medical perspective?
Yeah, so if you are living in a household with someone, that's obviously a situation where you're close contacts. I certainly don't wear a mask in my home with my husband. But if, for example, my sister would come over to my porch, we will both be wearing masks when we're 6 feet away from each other. Obviously, if you're eating or drinking, you can't wear a mask with that, so we'll leave it off for that moment. But in general, if it's not someone that you're already cohorting with and sort of quarantining with already, all bets are off. You don't know if that family member I don't know if my sister, could have gone to a grocery store and could have picked up the virus while she's at the grocery store and then given it to me, and then God forbid I give it to a patient when I go into my office. So you don't know if your family member went to another gathering. I mean, maybe you do, but you just you can't be too sure that maybe when they were at another gathering, they didn't get it either. I think we should all just do our best to try to adhere as best as we can, just to kind of make it as easy as possible for everyone. In all situations where you're going to be gathered, try your best to be 6 feet away, and if you and if you can, wear a mask, and if you can, be outside. It's just as simple as that. But again, if you're already cohorting with that person, you don't necessarily have to wear a mask, and you could probably sit less than 6 feet away from that person since you're already cohorted together. But if it's not someone you normally cohort with, this virus is so contagious, we just don't know. There's no way of knowing that you're high risk, I need to leave my mask on with you, but you're not, I can take my mask off around you. It's just too hard and too muddy, and the stakes are too high, to be honest. The stakes are just too high. As the mayor just said, we just had 2 deaths in the city, and it's very real. I had a lot of patients who had the virus and thankfully have recovered since the spring, but you better believe they don't want it again. Even the folks who've had the virus before, a man in Arizona was just diagnosed with coronavirus for a second time. So we know that the antibodies that you get from having the virus the first time, it's short term. It's only going to last a couple of months, so 2 or 3 months at most. So you can't even take that as like a get out of jail free card, so to speak. Just do your best to kind of follow these guidelines, because in the end, it's going to be worth it. We're going to keep each other safe and keep our economy open and keep our kids in school.
And Dr. Kong, one last question before we get to closing remarks. And this probably is a very difficult question, if there's an answer to it at all. But in spite of everything that's being done, why is the city's rate of infection so high?
I mean, when you look at when we speak to the contact tracing team, when we do contact tracing, I think the answer is that not everyone is listening. We're not here to put the blame on someone. We're not here to point fingers. We're here to just keep everyone safe. And I don't care how many times the mayor and I have to come up here and say the same thing over and over again. We'll do it. We'll do it because it's the right thing to do. And we do it because we know maybe this time one extra person will hear us and one extra person will put that mask on and keep it on. And at the end of the day, that is worth it. And that could help stop the spread to another 10 people. Remember, that Biogen conference had 175 people. It led to 20,000 cases. That wedding in Maine had 62 people. It led to an additional 120 plus cases and counting. So if we can just get one extra person to wear that mask, keep it on, wash their hands and socially distant, that's the right thing. It would have made this whole town hall today and all the town halls in the future worth it. But I think that's kind of the simplest answer I can come up with, is that there are still people who just aren't just listening, and that's fine. That's fine. Just better late than never. It's never too late to do the right thing. So even if you weren't doing it before, even if you didn't believe about it now, that doesn't matter. That was the past. We can also move forward together and lift each other up and help us all get through this together.
Thank you very much, Dr. Kong. We're approaching the 7 o'clock hour. It's 6:58. So, Dr. Kong, if you want to offer some final comments, and then we'll turn it over to the mayor to close it up.
Yeah, I mean, I think that last question was kind of a perfect, summary statement for me. Is just, it's never too late to do the right thing. It doesn't take, that much effort to do the right thing, although I know mask wearing can be annoying. Thankfully, the weather is getting a little less humid, so it won't be as obnoxious to wear a mask, but please keep wearing those masks. Please do the right thing. Try to limit your gatherings with folks. I know it's hard, and it's already August. It's been 6 months since COVID became a household term. I can't believe I'm still here saying it. But we have a long ways to go. Don't lose sight of the end game. Remain vigilant and get your flu shot.
Mayor, if you want to wrap it up, and if you would, there is a late question regarding the situation at the beach. So in your closing remarks, if you would just make some comment about the circumstances at the beach, and you can take it from there.
Yeah, so down the beach, the state, in consultation with the city, and with in consultation with a number of other cities, the DCR made a decision to restrict parking in a number of different locations. Revere Beach was one of them, and so parking has been restricted by 50%, and that was due to a couple of things. One, obviously, as a hotspot and as a red community, there are measures that are being looked at to try to hammer home the fact that this virus is not going away and that things have to be a little bit different. That's one. Number two is with Labor Day coming up, and I know that there's some nice weather approaching. That there is a expectation that there may be large groups gathering down the beach this weekend, and so in an effort to try to prevent that, there are additional restrictions of parking down the beach. And I don't take any of this lightly, whether it's from the beginning of this, shutting down businesses or changing the course of what our school day looks like, or changing what graduation ceremony we have, or even in the future, we're talking about what Halloween looks like and what that means. What it means to have Halloween during COVID. The decisions that get made and the changes that we have to adapt to are not easy. And I know that the uncertainty really does provide a level of anxiety in a lot of people. And these are not things that or decisions that I make without a lot of thought and a lot of care. And the thought and care is about saving people's lives. The thought and care is about the city employee that I saw today, and thinking about how to make sure that we prevent another death. So I really want to kind of focus on the people who are watching tonight to please be advocates for the things that we're talking about. Please understand that these are things that we have to do, and these are conversations that we need to have, because me or Dr. Kong talking on a Facebook Live, as she said, she'll do it as many times as needed, which I thank God that she is in the position that she's in for the city of Revere and for the residents of the city, but I need everyone who's watching to be an advocate for the things that we're talking about. I need you to own some of this messaging and make sure that people understand that these are lives that have been lost. These are lives that are never going to be the same. I know that the pushback that I've heard from people when we talk about the virus is, well, hospitalizations are down and there aren't as many deaths, and who's really dying anyway, and how are they dying? Well, put all that aside. Let's talk about somebody who gets the virus, who maybe goes into a coma, maybe gets intubated, and the impact that has on that person's life, even if they come out of it. That's a very real situation. It's a very real situation for hundreds of our residents who maybe didn't lose their life, but they sure as hell don't want the virus again, and their life isn't going to be the same. So I implore everybody who's watching to please do your part in helping us stop the spread of the virus. And I thank you for watching. I apologize for being a little bit down, but the fact is, as I said, we're in our 6th week of being in a place that our numbers are not where they should be. And so that's frustrating for me, and it should be frustrating for all of you. I'll end by saying thank you to Dr. Kong. Thank you for taking your time to do this. I know not only myself, but there are a lot of people who are very grateful and very thankful for the work that you've put in, and each and every resident in the city should be grateful and thankful for the work you put in, because you do it basically for free. So I really appreciate that, and I want to just thank everybody for watching, and I hope that you get the message, and I hope you can help us deliver the message. Thank you.
Thank you, Mayor Arrigo, and thank you, Dr. Kong. That concludes tonight's town hall meeting. Residents are reminded that the Revere website, www.revere.org, contains substantial information about the COVID-19 situation in Revere and Revere's response. Residents are also reminded that if they have specific questions, they could call 311 and get an answer, or at least get directed to an answer. So that concludes tonight's meeting. Thank you for your participation tonight, and everybody stay safe.
Stop the stream.